Hello everyone, so today we are talking about MRCP PACES, my exam day, and this is actually the second part of the video series that I've done for my exam day. I'm going to link the first part over here at the top, okay, so make sure you go and check that out if you haven't seen it yet. There is a lot of good information that I go through in that video, especially stuff like what I did when I arrived at the exam venue, what the exam registration process was like, what the exam venue was like, everything, okay? So for those of you who don't know me, my name is Dr. Vishal Kumar. I am a doctor in the UK, and I set up this YouTube channel as well as keenmedic.com, where you can find my PACES course and my book as well. So let's get started. So in this video, I'm going to go through the chronological order, okay? So this is a continuation of part 1. So I'm going to pick up where I left off, and I'm going to start talking about the time in between stations first of all, then the patients themselves, and then the examiners, okay? And then I'm going to talk about the nerves and what it was actually like when I was in the examination. And finally, I'll finish off. So what was it like in between stations, okay? So the time, those 5 minutes that you get when you are going from one station to the other, what is it like? So as you know, you get those 5 minutes, and those 5 minutes were actually pretty quiet. You know, you sit in the corridor in between stations and you read your scenario, right? And this is the time that you have to use to first and foremost, before you even read the scenario of the next station, this is the time for you to let go of the past. This is the time to let go, okay? The moment you step out of the last station, you have to breathe in and breathe out and let it go. That's what you have to do. So exactly what I've said here. And what I did was I just sat down with my crib sheet and the scenario, and then I read through the scenario, okay? After I did my breathing exercises and then just forgot about the past, because then only could I focus on what I'm about to do next with a clear head, okay? And then I planned my approach and ran through what I'm about to do in my head, as well as writing things down on the crib sheet, which, by the way, I've done a separate video, which I'll also link up here, okay? So make sure you have a look at that. The patients are an absolutely crucial part of the exam. These are the people that you need to keep at the very center of everything that you're doing, okay? It's not actually the examiners that you have to truly care about. You have to truly care about the patients. So I'm just going to run you through what they were actually like. During the examination stations where you examine like cardio, respiratory, things like that, they had a gown over them. They didn't really have their own clothes, and they were generally very nice, okay? Of course, you don't really talk to them. You introduce yourselves and you ask if they've got pain, but that's about it, right? But overall, they were just generally quite nice in terms of interaction. And they often smiled if you treated them well. And they were very easy to examine. They were very cooperative. They would move into the right positions for you. Almost, you know, they could predict what you would ask them, and they would almost get into position just as you were asking them. So it was extremely easy. It was extremely efficient. That's what I found. They helped you out. And in the history and communication and station 5 stations, I found that they gave you the right information, and they were obviously very aware of the time constraints, so they did not give you very long, drawn-out histories, okay? They kept it very concise. They kept it to the point because obviously they are aware that you are running out of time. And not only that, I found that they even sometimes helped you out by giving you what I would consider hidden information, something like past medical history, for example, okay? So in a patient with some kind of thyroid disorder that they may have come in with in station 5, before you even ask them, they might just tell you that they had thyroid surgery, for example, in the past, okay? And that is, of course, a huge help. This helps save seconds, minutes. It helps you go down the right path in terms of your differential diagnoses. However, they only tended to help you in this way if you were generally a nice doctor, a nice person to deal with, basically. So you have to come across as being someone who is keen to listen, someone who truly cares about them. Only then would they help you. Now let's talk about the examiners. So remember I said the patients are the core of your exams. That is very true. However, you have to remember that the examiners are the ones you have to impress, right? They are the ones with the power to award you the marks or take away the marks. So what were they like? What was my experience of the examiners who examined me? They kept things very kind of business-like at the start anyway. They just checked the ID, okay, as soon as you go in, and then they just simply stepped away. They just let me carry on with whatever I wanted or needed to do. They just observed from a distance. That's all they did. And it meant that they were just very easy to ignore, and I often forgot that they were there. I just carried on like I normally would. So they basically disappeared out of my sight. If I needed some clarification, if I needed some instructions, then they were happy to provide this. What I would do was that I would just turn to them and ask for clarification. For example, things like fundoscopy. They told me that, in one of my stations that I did not need to perform fundoscopy when I asked. So that kind of thing. And often they just simply asked, what are your positive findings or what are your differentials? So straight to the point, okay? Instead of asking me to present everything. They didn't usually do that because, of course, I suppose they were also aware of the time constraints. So they only purely asked for my positive findings or my differentials, which are more specific than having to present everything, if you imagine. So you should also be ready for just jumping straight to positive findings or just your differentials if your examiners don't want you to present the whole thing. So that's something that you should also be in the habit of doing. And I found that they quizzed me more about the management and causes of my differentials rather than the biochemistry or the genetics of it. What I learned from my experience is that they want registrars, okay, who are running the general medical take a general medical ward. That is my understanding. That is my observation of how the examiners proceeded to examine me, okay? And instead of the rumors that the examiners will ask you very specific genetic, biochemical or DNA mutations, things like that, I was not asked anything like that at all. It was all about clinical knowledge, clinical management, clinical acumen. That was all that they were concerned about. So this is particularly reassuring if you think about it, because they truly care about who you are as a clinician rather than whether or not some odd weird fact which won't directly impact your patient. Okay, so that's what I found reassuring, and for a lot of you who are watching this video, that's what I would strongly recommend. Okay, if you're struggling with memory, committing things to memory, I would highly recommend that you prioritize knowing the clinical knowledge first before you commit anything to memory regarding biochemistry, genetics, cellular biology, things like that. Don't do that as a first instance. For PACES, that's what I'm talking about, for PACES, okay? And lastly, what I found was that they even helped me out and allowed me to re-examine if the time was there, if necessary. Okay, so if they saw that I was a reasonable, sound candidate, and that I was justifying my answers to their satisfaction, and if I said that I would also examine for something, then they said, would you like to go ahead and examine the patient now? Okay, so they even allowed me to do that. They were lenient, is what I'm trying to say, as long as the time was there. Okay, so what you have to show overall is that you have to impress upon them that you are a sound clinician. That is the single most important thing, that you are sound and safe, that they can rely upon you as the next generation. Okay, and if they feel that that is the case, then they will be lenient with you. They will award you the marks. Okay, so I hope that that makes sense, guys. I just want to talk about the nerves now, the anxiety, the pressure. they actually stopped after the first 5 minutes or so of starting my very first station. I remember my very first station was communication. And of course, it's natural to feel a bit nervous. We're all only human, right? It is perfectly fine. So I did as well, which is why the crib sheet was absolutely vital in guiding me through all of this, at least at the start. But after about 5 minutes, I found myself just completely relaxing, just chatting to the patient's relative that I was talking to in the station. I also found that the nerves had gone to a point where I was being completely logical and I had a very clear approach. Okay, my vision was very clear. That's what I found. So the nerves don't stay with you for the entire thing. And I'd like to just reiterate this point again about letting go. This is absolutely key when you're doing an examination like PACES, because if you're not able to let go of what has just happened in the last station, then you are at a very high risk of ruining the station that is to come and overall your exam success. And that was in my view, one of the key reasons why I could find the level of success that I did in my exam. And I would strongly recommend that you practice this as well by setting up circuits in your practice. By my third station, I was actually very calm and very composed, and I had no nerves whatsoever. Okay, I had a very clear idea of what I was doing. I was able to just talk to the examiners like I had known them for many years. Similarly for my patients, as though I've looked after them for months and years. It just didn't feel artificial or even intimidating at all. It just felt completely natural. So I'd like to reassure you that this is something completely achievable, something that you can do, and that the nerves, although are natural, don't stay with you for the entire thing. And finally, of course, when you finish, what I found is that the 2 hours, they actually flew by. They ended very swiftly, and you just left in a bit of a daze really after the exam, because obviously you've come out after 2 intense hours. And people, your fellow candidates, will be discussing cases, but don't lose heart, because everyone's answers will be different for each station, for each case. The thing is, no one knows the answers, okay? So don't lose heart just because your answers were not the same as everyone else's. Just go home, enjoy, and look out for the results. You just never know what's going to happen. And that's what I found myself. My exams, my answers were different to everyone else, and yet I managed to pass. Okay, so I hope you enjoyed this, guys. I hope it was valuable. If you want to learn more, do go and have a look at my book. It is available on Amazon for purchase. The link will be down below, and so will my course, which has got all of these perks. And I do live monthly webinars for you guys on the student-only Facebook group. So make sure you check out the course as well. The link will be down below. I'll see you in the next video.